Hi, my name's Andy Williams. I'm a consultant plastic surgeon at Skin Surgery Clinic at Good Skin Days. This evening I'm going to be performing a local anaesthetic earlobe reconstruction on a young lady who's got multiple piercings in her right earlobe. She's previously undergone similar surgery to her left earlobe and, having been delighted with the results, has returned for further surgery today. I'm going to use a technique that uses effectively an M-shaped incision, which will allow us to partially reduce the length of the earlobe whilst at the same time taking out both of those smaller intact piercings as well as the one that's nearly split. Just make the same cut on the back to match the front. And there you go, piercings are gone. You just hear a small buzzing noise now. This is the Cautery machine. This just stops any small bleeding blood vessels. Just need to try and keep the area reasonably clean and dry. After a day or two you'll be fine to have a shower and wash your hair, but just don't soak the area, don't go swimming.